Hello and very warm welcome to the Canada News with your host Divya Rai. Now let's take a look on the headlines. Ontario Health Minister Christine Elliott outlines COVID-19 vaccine rollout process in the province. The Solicitor General of Ontario reports that the vaccine rollout is in full swing. NDP leader, National Leader Jagmeet Singh said his party was raising the same issue again and again and that this time it is important to make the paid sick leave program effective. Now news in detail. Ontario Health Minister Christine Elliott outlines COVID-19 vaccine rollout process in the province. He said that in the province, 50% of the citizens aged 18 and above have been vaccinated with COVID-19 vaccine. He said that 6 million people so far and the province has set a milestone in the vaccination process.
As of yesterday, over 50% of Ontarians aged 18 and older have received at least one dose of the COVID-19 vaccine. That's more than 6 million adults across the province. This is a very exciting milestone and a true testament to the determination and dedication of Team Ontario. We continue to see new records and milestones being met across the province, including in our hardest hit communities. Over the past 2 weeks, Ontario has allocated 50% of vaccine shipments to hotspot communities as part of a targeted, time-limited measure to help protect those most at risk and stop the spread of COVID-19. This approach is working. Over 54% of Ontarians aged 18 and older in hotspot communities have received at least their first dose of the COVID-19 vaccine. With an increased supply of vaccines, we will continue to make it easier than ever for those who are most at risk of COVID-19 to receive a vaccine. This includes our frontline healthcare workers who have been working courageously around the clock to keep our communities safe and care for patients suffering from COVID-19. As early as May 14th, high-risk healthcare workers will be eligible to book and receive their second dose of the COVID-19 vaccine earlier than the recommended 4-month interval. As we continue to fight the third wave of the pandemic, we are truly grateful for the sacrifice of our healthcare heroes. I also want to address the recent decision to pause the rollout of first doses of the AstraZeneca vaccine. This decision by the Chief Medical Officer of Health was made out of an abundance of caution. Those of you who received your first dose of AstraZeneca did the right thing to protect yourselves, your loved ones, and communities, and vaccines remain our best defense against this virus and our way out of this pandemic.
The Solicitor General of Ontario reports that the vaccine rollout is in full swing and that the 80 pharmacies in the Peel and Toronto are currently administering the Pfizer vaccine and 60 pharmacies in Drummond, Hamilton, York Region and Ottawa are administering the Moderna vaccine. He said that this has been accelerated the vaccine rollout in hotspots and workplace vaccination units are also being set up.
Ontario continues to make tremendous progress on the vaccination front. The predictable and increased supply is enabling our province to protect more people from COVID-19 and significantly reduce pressure on our hospitals. More vaccines also means we are able to reach a greater number of people through an expanded rollout at local pharmacies. At this time, nearly 80 pharmacies in Peel and Toronto are offering the Pfizer vaccine, and up to 60 pharmacies in Durham, Hamilton, Ottawa, Windsor-Essex and York Region are now offering the Moderna vaccine to individuals aged 18 and above. This initiative will continue to expand on a weekly basis with almost 2,500 locations to begin offering the Pfizer and Moderna vaccines by the end of May. We are also making strides to help speed up vaccinations in hotspot communities by continuing to work with public health units and employers to get more people vaccinated. Workplace vaccination clinics continue to operate for employees who cannot work from home, as well as providing additional vaccine access in hotspot communities where they are located. Building on these access points, a workplace vaccination clinic has been launched this week at Bruce Power, located in the Grey Bruce region. This facility is critical to Ontario's electricity supply and is a key supplier of medical isotopes used in personal protective equipment sterilization. Additionally, last week, mobile units began vaccinating workers at small to medium-sized workplaces in York, Toronto, and Peel regions. And in the coming weeks, these mobile units will continue to administer vaccine doses to thousands of workers by visiting workplaces that support the food supply chain, manufacturing, transit, as well as postal services. This robust and sustained vaccination campaign, the largest in Ontario's history.
NDP national leader Jagmeet Singh said his party was raising the same issue again and again, and this time it is important to make the paid sick leave program effective and to vaccinate Canadians as soon as possible. Therefore, the federal government will have to take the initiative and take effective steps. Singh clarified that he will continue to raise his voice for this.
To focus on what people need most in this pandemic, the two things we've been saying again and again, I want to repeat, we need to make sure paid sick leave works. We have a federal program. The federal government, the Liberal government has obviously acknowledged that they have jurisdiction. They brought in this program because we fought and pushed them to do so. It just needs to be better so that people don't have to go into work sick. This is one of the most important tools to stop the spread of COVID-19. I don't understand why the Prime Minister is not just fixing the program. He knows, the experts have made it clear, there are some key problems, flexibility. We need to make sure it's easier to access and it covers a full days of work so that a worker will actually access the paid sick leave and be able to stay at home when they are sick. Secondly, we need to get vaccines to communities who need it most. This continues to be a problem. There's been lots of confusion, lots of mixed messages. We just need to get the vaccine to the communities who need it most immediately. It still continues to be the fact that those who need the vaccine the most are the communities that have the highest rate of infection, but the lowest rate of vaccination. That is a problem. We need to fix that. Yes, I wanted to start off by just talking about how I want to encourage people to follow public health guidelines and to keep each other safe. But yes, it is shocking that the Liberal government, from what's been raised, are not following the requirements of 14-day quarantine, and they're not following the rules. We should be setting good examples. The Liberal government should be setting a good example to make sure that we are showing leadership in following through with the public health guidelines. It is shocking that it seems like the Liberals are not doing that. I can tell you, I got the AstraZeneca vaccine. I really believe that the idea that we take the first vaccine available to keep ourselves safe, the risks of getting COVID-19 and the complications and the symptoms, from what I've heard from public health experts, is far worse than the risks of taking the vaccine. So I believe we should be taking the vaccine. And again, I defer though to the public health guidance in terms of what is the best course of action.
Liberal MPs Kamal Khera and Sonia Sidhu congratulated everyone on National Nursing Week and Eid. Khera thanked all the nurses. Prime Minister Justin Trudeau also thanked the nurses for their contributions.
This week is National Nurses Week. Nurses across Canada have made tremendous sacrifices to keep us safe and protected from COVID-19, and we thank them for their dedication, commitment, and compassion. As a proud registered nurse myself, I've seen those sacrifices firsthand while working alongside incredible nurses in long-term care hard hit in the first wave in Brampton, and now on the other side by vaccinating as many Canadians as possible. Will the Prime Minister join me and all Canadians in recognizing the fundamental role of nurses during this pandemic and beyond?
Right Honourable Prime Minister.
Mr. Speaker, allow me to begin by thanking the member for Brampton West for her unwavering dedication to her community as both an MP and a nurse. Nurses are the backbone of Canada's healthcare system. They've helped us through every aspect of this pandemic, from the emergency room to the ICU, from vaccination clinics to public health units, from long-term care to mental health services. This year has been incredibly challenging for healthcare workers, and we owe nurses deep gratitude for their heroic efforts fighting COVID-19 on the front lines. To all nurses in Canada, thank you. We are grateful for your service.
Assalamu alaikum. I'm Sonia Sidhu, your Federal Member Parliament from Brampton South. As we come to the end of the holy month of Ramadan, I want to reach out to my Muslim brothers and sisters and wish them a very happy Eid al-Fitr. I know that this year you will not get to visit your local mosques for morning Eid prayers or visit extended family in the spirit of Eid. I wanted to thank you for choosing to keep each other safe and celebrate within your household throughout this Ramadan. I have been humbled by the charities and donations carried out by the Muslim community. In this pandemic, you have uplifted those in need, reminding us of helping others and shaping our communities for the better. Eid Mubarak to everyone.
Toronto Mayor John Tory discusses Nursing Week, saying nurses have been and made invaluable contribution during the corona call. Informing about the vaccine rollout, he said that Team Toronto has so far distributed 1.5 million vaccines. For this, he thanked the healthcare hospitals and pharmacists.
There are two groups that are in very good company with one another this week because it is both National Nursing Week, which we spoke about on Monday, and it is also National Police Week. And we spoke about the courage of our nursing people, nursing professionals in the province and in the city on Monday. And today I think we can salute equally the courage and the service of our police officers, the women and men who serve us each and every day under the leadership of Chief Raymer and do a good job keeping the city safe and at the same time working hard on finding opportunities to modernize policing in the City of Toronto and be a leader in that regard. May I also say at the outset a happy Eid Mubarak to our friends in the Muslim faith community. This is a very important event on their calendar each year, and unfortunately, like many things, they'll have to celebrate differently and safely. But nonetheless, they will be celebrating, and we join them in marking Eid as a very important occasion on the calendar. Team Toronto has now distributed more than 1.5 million doses of COVID-19 vaccine in the City of Toronto, the first city in Canada to reach that threshold. On behalf of all of the residents of the City of Toronto, I want to thank our hospital, our healthcare, and our community partners, along with all of the Toronto Public Health and city staff who've made that happen. They've been working really hard in many different respects to get people vaccinated in the City of Toronto. It is amazing to see the city's dashboard on vaccinations with higher and higher percentages of age groups being vaccinated as the province opens up eligibility and as vaccine supply has increased. More than 70% of adults 80 plus, for example, have been vaccinated. More than 75% of adults between 70 and 79 have been vaccinated. More than 71% of adults between the ages of 60 and 69. And 61% of adults between the ages of 55 and 59 have received their shot, while almost 53% of adults between 50 and 54 have been vaccinated.
Toronto Medical Officer Dr. Alan Dybla said 840 new positive cases were reported in the City of Toronto today. 1,081 patients are admitted to hospitals and 265 critically ill patients are undergoing toxic treatment in ICU. He also confirmed 20 deaths in the City of Toronto.
Today, I am reporting 814 new cases of COVID-19. 1,081 people are in hospital. 265 people are in the ICU. And I'm saddened to report 20 deaths today. As you've just heard from the Mayor, there is increasing momentum in the vaccination campaign, and this is welcome news for all of us. Just a few hours ago, the province said that almost 4 million doses of vaccine will be delivered over the month of May, and that details are being finalized to expand vaccine access to children and teenagers between the ages of 12 and 17. We at Toronto Public Health are looking forward to receiving these details and ultimately to working with the relevant partners to get this done. On the ground in Toronto, we will see the expansion of neighbourhoods, which will have pop-up and mobile vaccine clinics. This approach has been enormously successful in facilitating vaccine delivery. Neighbourhood enthusiasm for the pop-up and mobile clinics reflects this. In our excitement and in our understandable tendency to count needles in arms, we may forget that our shared goal, our real goal, is this: the health outcomes of vaccination. People protected from severe and life-threatening illness and reduced spread of COVID-19 amongst those yet to be vaccinated. As with so many aspects of the pandemic, the pop-up and mobile clinics have emerged unexpectedly as a real success story.
Brampton Mayor Patrick Brown provides weekly update of COVID-19 in the city. He said that in the view of the effects of the coronavirus, the provisional government has issued some restrictions. Mayor Brown says the city's advisory table is discussing all the criteria. He appealed to the people to follow all the guidelines issued by the public health.
It's important we listen to the science, the data, the medical advice. I was on a panel earlier this week with Dr. Peter Juni, the head of the Ontario Science Table, where he was passionately advocating for the lifting of outdoor restrictions. Whether it's golf or tennis or cricket, there are many outdoor sports that can be governed in a very safe fashion where there is physical distance. And we need to, it's been a tough enough year, we need to let people get exercise. And if you look at the weather ahead, you know, to keep people cooped up when we have a beautiful weekend, a beautiful week ahead as the weather gets better every week, I really want to stress, if you listen to the medical advice, if you listen to the data and the science, fresh air is important. It's not only important for physical health, it's important for mental health. And I was pleased this week to see the Canadian Pediatric Society come out highlighting their concern for youth mental health, having children confined indoors for extended periods, and why it's important to get them outdoors and engaged in recreation. So I believe there is a growing momentum to have these outdoor amenities opened, growing momentum in the science community, in the medical community, and I can tell you from a municipal perspective, having these facilities shuttered, having our soccer fields closed and our cricket pitches closed and not being able to have our golf course open or tennis courts locked, it's creating a bleed for the city. Just for this year, we're forecasting based on the spring closures because of a lack of rentals. The city's going to lose $2.1 million on rentals from outdoor amenities. And so there's a financial cost on top of the physical health cost and the mental health. And so I will continue my advocacy that I believe outdoor amenities should be open, even during the lockdown, because they're safe and recommended by the Ontario Science Table. The next thing I wanted to mention is one activity we are allowed to do during this stay-at-home order is bicycling. That's one of the few physical activities that's permitted, and we've really expanded our active transportation map. If you're interested, you can go to brampton.ca, but we're building cycling paths around the city. We're building our first ever active transportation master plan.
Brampton Medical Officer Dr. Lawrence Law said that the rate of coronavirus positive cases in Brampton this week was 16.3%. He said that the rate of record cases this week was lower than last week. He also said that 50% of the population in Peel region has been provided with COVID-19 vaccine.
This week, Brampton's test positivity is at 16.3%, with a weekly incidence rate at 387 cases per 100,000. These numbers are both down from last week. At the same time, as of yesterday, we have reached 50% first dose coverage of Peel's adult population. These trends all give me a cautious optimism, even if we do need to stay the course for a little while yet. Certainly our transmission rates appear to be declining. However, our hospitals are continuing to transfer patients and face capacity challenges. We know that we must firmly come down the other side of this curve and continue to save lives and protect our healthcare workers and our most vulnerable in the current moment. We cannot let up yet with our hospitals still overflowing. We need to ensure that those numbers also start to come down. On the other hand, our vaccination program is also hitting its stride thanks to the provincial government's prioritization of Peel as a hotspot for additional doses. We are on pace this week to have our biggest vaccine week yet, getting over 20,000 doses in arms every day, and striving to get to 150,000 doses delivered this week. 150,000 doses will add 14% coverage to first dose coverage to the community, which at 50% yesterday brings us even closer to our first goal of getting to 75% first dose coverage in Peel. Limiting our contact and interactions also remains critical to ensuring that we seal the deal and bring this third wave under control. Once the third wave is tamed, the increasing first and second dose coverage in our community will hopefully allow us to reopen gradually and with confidence. So I encourage all our residents, as I said, to stay the course. Limit your in-person interactions outside your house to only the most essential purposes, and when you do meet someone who you do not live with, ensure that you are distanced, masking, and preferring the outdoors. Do not meet if you are sick, get tested and self-isolated instead, and please get your shot. Thanks to the provincial allocations, all adults 18 plus are eligible as we expand offerings across the region. Our mobile clinics are getting into more workplaces to vaccinate those who cannot work from home, and also getting more and more to our hardest to reach communities who are otherwise unable to attend at a mass clinic, and Mayor Brown has already outlined some of our big clinic offerings that are coming up.
Mississauga Mayor Bonnie Crombie discusses outdoor restrictions in the city. He also mentioned the risk of transmission through the outdoor gatherings. He also spoke about International Nursing Day and commended the nurses for their contribution during the COVID-19 epidemic.
I've been strongly advocating for the province to lift restrictions on outdoor recreation. And I've invited Dr. Uni here today to talk a little bit about the low risk of transmission in outdoor settings and why it's so important to open these public spaces up for use. I want to recognize that today is International Nurses Day, and I want to thank all the nurses at Public Health, Trillium Health Partners, and across Mississauga for supporting our community. Our nurses have played a critical role in the battle against this virus, taking care of COVID patients, administering tests, and of course, administering vaccines. On behalf of the City of Mississauga, I want to thank everyone for working together to get this all done. Last week, I told you that I was starting to feel hopeful, cautiously optimistic about the COVID-19 situation facing Mississauga and all of Peel. And this week, my optimism is growing a little further. Our COVID-19 numbers continue to move in the right direction, with daily case counts decreasing by 2.5% almost each day. Peel Region is now averaging 297 cases per 100,000, which is down from 347 per 100,000 a week ago. Mississauga is averaging 240 cases per 100,000, and that's down from 282 a week ago. And the situation in our hospitals is beginning to stabilize. In Mississauga, Trillium is dealing with 90 COVID patients, 23 patients in the ICU, and another 19 suspected COVID cases. The situation is similar at William Osler Hospital, with 65 COVID hospitalizations, 11 patients in the ICU, and 47 suspected cases. But what's truly giving me the most hope is that our vaccine rollout has been completely ramped up here in the region of Peel, with everyone 18 and older now eligible for the vaccine. This was so critical for us to do.
Fans of the Canadian Museum of History will have to wait until June for the museum to welcome them once again. An announcement from the museum confirmed that the museum located in Gatineau will reopen on June 2nd. It is also the same day Ontario's stay-order home is expected to lift. Visitors will be welcomed back with the special exhibition Queens of Egypt, which was originally scheduled for May 19. The exhibition includes 300 iconic objects, including monumental statues and jewelry associated with queens like Nefertari, Nefertiti, and Hatshepsut. Visitors can book their timed admission tickets online beforehand. So that's all we have in this bulletin. Thanks for watching. Stay tuned for more updated news.